Welcome to The Explainer. Today, we're talking about a really fascinating shift in thinking. For decades, right, most countries have looked at healthcare as this huge, unavoidable expense. But what if that's all wrong? We're going to unpack how Morocco is flipping the script, turning its health sector from a cost into a powerful engine for economic growth. All right, let's get into it.
You know, at the heart of all this is a major change in perspective, one that the global pandemic really kicked into high gear. The idea is actually pretty simple, but it's powerful. Health isn't just a bill to be paid anymore, it's a strategic investment. We're not just talking about fixing what's broken, we're talking about building a core national asset, something that drives both resilience and the economy.
And believe me, this isn't just talk. Get this, between 2018 and 2022, per-person health spending in Morocco shot up by a whopping 28.7%. That's a huge injection of cash. And it's basically proof that this new philosophy has some serious money and political muscle behind it. So, how does this whole health economy thing actually work on the ground? Let's break it down into a few parts. We'll start with the part that's most visible to all of us, the core delivery of care. I'm talking about the hospitals, the clinics, and of course the professionals who make it all run. Just look at the speed of this expansion in the private sector. The government opened up the rules for investment and boom, the number of private clinics jumped from 356 to almost 440 in just 5 years. That's a flood of new capital that's creating jobs and giving patients way more options.
But hold on, this isn't just a story about private money. The public system has been growing like crazy too. You can see the number of primary care spots, which are absolutely critical for local access, is now over 3,000. Hospital networks, emergency services, they're all expanding. It's all part of a national plan to make sure everyone can get care no matter where they live.
Of course, shiny new buildings are pretty useless without the right people inside. And that's why Morocco has set this really ambitious goal, to train 90,000 new health professionals by 2030. This isn't just about plugging a few holes. It's about building a deep bench of talent that can power this health economy for decades.
Okay, so this incredible growth in care brings up a really important question. All these new doctors, all these new clinics, they need stuff. They need everything from basic medicines to really advanced technology. So who's making it all? That question leads us right into the next piece of this puzzle.
All right, welcome to the engine room of the health economy. This is the world of pharma companies, medical device makers, and cutting-edge R&D. It's the part you don't always see, but it is absolutely essential for powering the entire system.
Let's kick things off with pharmaceuticals. And right away, we see a huge success story. Local companies are now making over 70% of all the medicine the country needs. That is a massive step towards what people call sanitary sovereignty. Basically, not having to rely on other countries for your medicine. But see that other 30%? That slice of imports tells a whole different story.
And here's where you see both the challenge and the opportunity. In 2023, Morocco imported 9.2 billion dirhams worth of pharmaceuticals. At the same time, it only exported about 1.5 billion. I mean, that gap is enormous, and closing it could be a massive win for the Moroccan economy. Now, moving away from drugs for a second, there's another area that is just exploding. The market for medical devices in Morocco is now worth 6.5 billion dirhams. To put that in perspective for you, it was just 3 billion back in 2019. It has more than doubled in just a few years, mostly because the government is buying so much new equipment for all those new hospitals. So where's all the cutting-edge innovation happening? You might think it's in pharma, but the real story is somewhere else entirely. It turns out local medtech patents make up 7% of all patents filed in the country. That's more than double the rate for pharmaceuticals. It points to this really vibrant homegrown scene in startups that are creating the next generation of medical tech.
Okay, so we've looked at the people delivering care and the industry that supplies them. But for any of this to work smoothly, it needs a solid framework. And that brings us to our third part, the support system. Think of things like insurance, administration, and regulation, the stuff that happens in the background.
A huge part of this reform was building a modern government structure to oversee everything. So new strategic groups were set up. You've got a high authority of health to act as a regulator, a special agency just for medicines, and new regional groups to manage things locally instead of from the top down. This is the strong, efficient administrative backbone they're building to hold the whole system up. So what does this all mean for the average person? Well, it means a huge increase in security. The national health insurance coverage rate has just skyrocketed from 64% in 2018 to nearly 90% today. This is massive. It means people pay less out of their own pockets, and it creates a stable flow of money to fund the entire health economy.
And if you want to understand just how big this national project is, look at the price tag. The whole social protection reform, including this health expansion, is estimated to cost 51 billion dirhams every year. That is a monumental investment in the well-being of its citizens, and it's designed to fuel the whole economic cycle.
You know, this big transformation is also creating some growth in places you might not expect. While pharmacies and clinics are growing steadily, the fastest growing part of private care is, wait for it, physiotherapy. It's expanding by about 10% a year. It just goes to show there's a rising demand for rehab and wellness services.
So, we've walked through the core care, the industrial engine, and the support framework. Now let's pull it all together and look toward the future. What's on the horizon for Morocco's bold experiment in building a true health economy?
Now, we've got to be realistic here. This is definitely a work in progress, and there are still some pretty big challenges ahead. Things like ongoing staff shortages, big differences in care between different regions, and the need for the public and private sectors to work together better. Tackling these issues is the next crucial step in this whole transformation. So, after this whole journey, we can come back to a pretty clear definition. When we talk about a health economy, we're not just talking about hospitals and clinics. We're talking about this whole dynamic ecosystem where frontline care, the industries that supply it, and all the financial and admin services that support it all come together. And that really leaves us with one final powerful question to think about. You know the old saying, a nation's health is its wealth. Well, by treating healthcare not as a cost, but as a strategic investment, Morocco is really putting that idea to the ultimate test. So what does this incredible shift tell us about its ambitions for the future? Thanks for joining us on The Explainer.